Is polio coming back? Many people have asked me that question. But you say, we think that polio is history. It is gone, it has been eliminated from the landscape. But you say, we have said the same thing about measles. We have measles outbreaks now because there has been a very, very effective anti-vaccine program going on. So this anti-vaccine, anti-immunization program in the future might lead to outbreaks of poliomyelitis. So it is better to know about this disease and to have some plan to combat this disease. So I want to talk a few minutes about poliomyelitis. It's a disease of the anterior horn motor neurons of the spinal cord and brainstem. It's caused by a polio virus. Anterior horn cells, they control the skeletal muscle cells of the trunk and limbs. So you can guess, because this virus attacks the anterior horn cells, which supply the skeletal muscles of the trunk and limbs, those areas will be affected. The functions carried out by these muscles will be affected. In up to 95% of cases, poliovirus infection is asymptomatic. And that's a good news. 95% of people who are infected do not show any symptoms. The viral transmission is oral to oral or oral to fecal to oral. Acutely, the poliovirus enters the body through the GI tract. It reproduces in the GI lymphoid tissue and then spreads to the large motor nuclei of the spinal cord, the brainstem, reticular formation, hypothalamus, thalamus, cerebellum, and cerebral cortex. What about symptoms and signs? Thankfully, not every polio infection results in paralysis. It can be divided into following types based on the severity. Number 1, abortive poliomyelitis. It is characterized by fever, headache, vomiting, and diarrhea, constipation, sore throat, and these symptoms last 2 to 3 days. Then there is non-paralytic poliomyelitis. These patients will have all the symptoms we have talked about in abortive poliomyelitis plus meningeal irritation and muscle spasm. But you don't see frank paralysis in these patients. Then there is paralytic poliomyelitis. Asymmetrical paralysis, proximal limb muscles are more often involved than distal, and lower limb involvement is more common than upper. Then spinal poliomyelitis, it involves the muscles innervated by the spinal nerves, flaccid and weak muscles, absent tendon reflexes and fasciculations. Then there is bulbar poliomyelitis. It involves the muscles innervated by the cranial nerves 9 and 10. It is seen in up to 20% of polio patients with paralysis. It affects the swallowing, speech, facial muscles. Then there is post-poliomyelitis syndrome. It is characterized by fatigue, pain, respiratory problems, sleep problems, increased risk of falls. Now, when we talk about polio in the differential diagnosis, we should always think about GBS, Guillain-Barré syndrome. Always think about GBS in the differential diagnosis of polio paralysis. GBS is distinguished from polio by its symmetry, disturbances in sensation, lack of preceding aseptic meningitis, and absence of CSF pleocytosis and presence of multifocal demyelination and electrodiagnostic testing. And in the diagnosis, how do you diagnose polio? You do virus isolation and you type from throat swabs and rectal swabs, PCR amplification of poliovirus RNA from the CSF. The treatment of poliomyelitis is supportive, pain relief, physical therapy, mechanical ventilation for respiratory failure, intubation or tracheostomy for secretion control. And That's why you say this is a scary disease. How can you think about those iron lungs and people put on those respiratory machines, and this is scary disease. That's why we need to educate people to get polio vaccine. There is trivalent live oral polio vaccine, and there is also inactive Salk parenteral vaccine. So this inactive vaccine is available in 4 recommended doses in ages 2 months, 4 months, 6 months, and 4 to 6 years. So that's about polio virus, and an effective vaccine program will prevent this disease. Those are the important points I wanted to share with you. If you want to consult with us, please visit us at Dr. Paul's clinic. Please call us for an appointment. My phone number 814-424-2095. Thank you. Have a good day.